we know that many of the disparities that we believe contributed to premature mortality were probably preventable causes. So we know from prior research that there are disparities in substance use, there are disparities in mental health, there are disparities in cardiovascular risk factors in this sample. And these are measures that are preventable and screenable. So what clinicians can do is they can make sure they're using evidence-based screening and care guidelines for their lesbian, gay, and bisexual patients. For example, lesbian, gay, and bisexual women have higher rates of sexually transmitted infections than heterosexual women, but they're actually really under-screened for sexually transmitted infections because clinicians who know their sexual orientation may think, oh, they're at lower risk because they might not be having male partners. And so making sure to not make assumptions about risk based on knowledge of sexual orientation is extremely important. They can also make sure to give really proactive screening for tobacco, alcohol, and drug use to all of their patients, in particular their lesbian, gay, bisexual patients. And treatment needs to be made available without judgment. One of the consequences of systems of discrimination is that people use adverse health behaviors to cope, and that can lead them to avoid care because of fear of judgment. And so this needs to be provided without judgment.